Last spring, leaders at the helm of health systems had to throw out their strategic plans for 2020 and start fresh to respond to demands from COVID-19. The unprecedented circumstances brought forward new innovations and key lessons. Our moderator, Lisa Maddox, Global and U.S. Health Transformation Practice Leader at EY, will lead a discussion on how to be more agile and how to be a more agile and adaptable leader and successfully lead your organization in a time of crisis. Lisa?
Thank you, Jody. Welcome all. We're very excited to have you here today, and hopefully you started your day with some great sessions. We're joined by some really wonderful panelists, and I want to quickly introduce them so we can jump into our topics of the day to talk to you about what we're really seeing in the industry and what we hope will be the future. We're joined by Dr. Melinda Estes, President and Chief Executive Officer of St. Luke's Health System, Dr. Janice Nevin, President and Chief Executive Officer of Christiana Care Health System, and Katul Patel, Chief Executive Officer of Virginia Mason Franciscan Health. So we want to jump right in today and talk about the questions that we think are driving leaders in the industry. So let's start with Mindy, I'm sorry. Could you talk about what were the major leadership lessons learned throughout the crisis for you?
Well, thanks very much. It's a pleasure to be here today. And I think there were lots of lessons learned during this pandemic. Obviously, COVID caused a monumental shift in how American healthcare will operate from now on. And, overnight, we had to learn to do things very differently. I might just highlight four things. One is, in healthcare, we tend to like to study. We have committees, we study a problem, we study it some more, we often pilot it, but we really in COVID, which was unforgiving, had to make decisions with imperfect information, make those decisions quickly, and oftentimes bring together disparate groups of people who don't talk together very often. What we learned is that we could make good decisions quickly, and if we needed to tweak a decision, we could do that on the fly and by and large make things happen in a very timely manner. One of the things that I hope will remain post-pandemic is this ability to respond quickly. A second thing I might mention really is just listening to our frontline caregivers. I think we always do that, but it was really critical to listen, to understand, not to respond. Certainly the lessons from our healthcare heroes at the front line, I think, informed how we managed the crisis. And third is really, it goes without saying, communicate. Being committed to a culture of communication and transparency. There was so much we didn't know, and the ability to be transparent and say, this is what we know, this is what we don't, and to update our communication, oftentimes many times a day, but always trying to be authentic as we, in fact, interacted with all of our organization and our community.
Thank you. Does anyone else want to add to that?
That was very well said, Mindy. I would just underscore the importance of the listening that we did as leaders. I mean, I always think that it's critical to connect to frontline, and it was ever more critical as we were managing through the pandemic. I think the other piece, certainly for me, and I've heard other CEOs talk about this, we have always appreciated our caregivers and talked about them as our most important resource. But I think that was so highlighted by the pandemic. Our people were simply extraordinary. They rolled up their sleeves. They did what they needed to do to take care of the community, to take care of each other, and frankly, at some personal risk, or at the same time as they were also concerned about their families. And I think certainly for me, the experience of leading through this, we're still leading through it, has really highlighted the importance of caring for our people.
Yes, absolutely. And Dr. Schrenk, let me introduce you really quickly. So we're also joined by William Schrenk, who is the Chief Medical Officer at Humana. So happy that you were able to get in.
Well, I would like to add, in the spirit of true vulnerability. In my challenges technically with joining you all, this has been an incredibly uncertain time, and whether it's figuring out how to join a Zoom call or figuring out how to help your parents work through a digital system to arrange for a vaccination, we're all personally dealing with uncertainty, and our associates and our partners are all dealing with uncertainty every single day. And I think one of the lessons from this experience has just really been about our own vulnerability, our need to be transparent, this urgency for radical transparency and to admit what we do and don't know. And this concept that we're all kind of going through this together. I think it built a great deal of momentum. I hope you're feeling that for me right now after my difficulty joining you. And I think that was really a key theme for us, for our leadership team, as we were trying to galvanize sort of energy and alignment around the work.
Yeah. Dr. Patel, I think you're on mute still.
Okay. How's that, better?
Better.
I apologize for that. And I think, I just want to comment on Dr. Schrank's comments. I think they're really well said, along with Mindy and Janice. But, we were sitting here in Seattle. We were in a very unique place. We were obviously at the start of the pandemic. We were the first in the country. And there's so much evolution of guidelines and evolution of how to take care of our patients. I think I just want to also reinforce again is the point about communication. Even when you don't know, you should share that you don't know. And I think it's just an opportunity for all of us to look at our staff and ask our staff, hey, help us figure out the best approach to treating our patients. And as all of us know, there's a lot of complexities around getting directions from each individual governor. We also had a lot of complexities around CDC. There's a political climate that we were living in under an umbrella, if you will, but we had to do what was right for our patients. And the best way to do that is to connect with our physicians, clinical staff, frontline staff to tell us, how do you shape how we're going to take care of our patients now into the future, and what resources do you need? So I want to just emphasize, like I know Mindy and Janice did, the importance of that level of direct communication with our staff.
But I think we're still going to have to do that going forward. So,
if I could just amplify Dr. Patel's comment, I think we also all need to just recognize the triumph of science. And we really are now the stewards of science. We understand in healthcare that it's both an art and a science, but, perhaps the greatest medical breakthrough of our generation in terms of how we care for patients now, as opposed to early in the pandemic when they were struggling on the West Coast, to therapies, to testing, to vaccination, to what comes next. And I think we really need to step back and recognize that going forward, we are the stewards of that science to not only our own workforces, but to our communities as well.
Absolutely. So, Katul, could you talk a little bit about what innovations, one of the other topics of this conversation is about the innovations that we were able to take advantage of, and which ones do you really think are going to continue moving forward? So, as Mindy said, we hope some of these changes of being able to move quickly stay in place. What do you think is going to move forward with us?
Well, I want to comment specifically around what we've done at Virginia Mason Franciscan Health first, and just talk about what I believe is going to happen in the climate of healthcare. Almost 19 months ago, before the pandemic came to us, we actually stood up what we called our Mission Control Center. It was built primarily as a NASA look and feel to it in terms of monitors, but we were challenged with occupancy over 100% at many of our hospitals. We're having challenges in throughput. We had deep challenges in terms of growing communities, et cetera, getting the kind of care that they needed. And we stood up our Mission Control Center to help us control where the flow of patients were going to go, where the resources were going to be needed. We didn't plan for it to help us during the pandemic, right? Because we didn't know the pandemic was coming. And here we are having the root of and the core of what we built, the Mission Control Center, really helping us navigate as our COVID surges and outbreaks happen at different campuses, moving our patients to different campuses, et cetera. So that's something that locally for us will not only continue to stay, but proliferate in terms of how we can potentially utilize it. But the one that I know that all of us talk about is telehealth and telemedicine. just locally again, our virtual care within Virginia Mason Franciscan Health was less than 1-2% before the pandemic. We peaked at 25-26% for all of Virginia Mason Franciscan Health. Now we've seen almost 450,000 virtual visits. It's staggering, the numbers that we're seeing. And when you're challenged with facilities, when you're challenging for looking for decreasing the cost of care, this is a great opportunity for us to really continue that journey on moving forward. It's something that we've talked about here in our organization. Many of my colleagues around the country have raised that as one of the biggest issues we see moving forward. But I'm obviously going to be very interested to hear what Mindy and Janice and Bill would have to say as well.
Yeah, thanks. I agree. I think all of us learned so much about the capabilities that we have that we didn't realize we had around virtual health. But I would take as I think about sort of coming out of this and what have we learned, I don't think it's sufficient to celebrate the growth in telehealth visits. I think we have to think very differently about how we deliver care. One of the initiatives that we stood up was based on our ability to leverage a platform that we had to aggregate data around a sick patient at home, a sick patient with COVID at home. So use the data that came from their in-home devices, along with secure texting and other ways to input information, personal information, apply analytics, create a risk score, and then elevate to a virtual care team, when that individual was starting to get into trouble, and essentially allow for an intervention either in the home or changing the location for care before they got into trouble. And so, I think that, we owe it to all of the suffering that has occurred over the last 15 months to take everything we've learned, all those new skills that we've developed, and think about how do we deploy them in a very different way. So we're changing the delivery model, and we're creating a much more resilient and sustainable approach, not only to care, but how we pay for that care.
That's great.
Yeah, I would add, I think that that this sort of concept that that care can be given and must is now sort of telehealth is a key piece of that. Care in the home is kind of it's at a time where we're going to start thinking about sort of not the workflow of the doctor, we're thinking about the workflow of the patient. We're going to meet patients where they are, and we're going to really drive care to where the patient is. I think that's going to be the nature of how care is delivered in the years to come, and that's really, really been accelerated as a result of the pandemic.
So that leads us right into the next topic I really wanted to talk about, which is what have we seen in terms of the focus that this has brought on inequities of care? And how do we then think about, what do these innovations do to help us with that? But what other things are you thinking about focusing on to deal with what we now have seen in those inequities? And Bill, would you like to start with that?
Sure. Well, I think the very bright light that was shown on disparities in the rates of infection, the impact of the disease on Black and brown populations, greater mortality, greater impact, economic impact of the virus, really, really underscored the need for us as a system to be more intentional. We've known about disparities for a long, long time. And I think all of us have been focused on addressing health-related social needs and trying to focus on those social members or patients, and that all of my colleagues spend a considerable amount of time thinking about. But the pandemic has really forced us to be more intentional, to say it's not enough just to focus on the food insecurity, housing insecurity. It's not enough to address social isolation or transportation issues. We have to be very, very thoughtful about the understanding sort of some of those underlying causes and trying to really focus on the populations that need our help most. And I think it has accelerated the way we think about measurement. It has accelerated the way we think about targeting focused outreach. It's accelerated our need and our urgency around cultural competence as a framework for every single interaction we have with our members, our patients. I'm certain that increasingly equity is going to be a key outcome in all of our value-based models. And as we work towards a value-based care system where, where our incentives are aligned with using telehealth, or our incentives are aligned with visiting patients where they are in the home, that our incentives are aligned with thinking more holistically about the health of our members and addressing health-related social needs, that measurement and that focus around health equity is going to increasingly come into focus. So I think this is the beginning of a really important pivot in the healthcare system where there's going to be a much greater attention to health equity.
I might just pick up on what Bill said about being intentional. I think all of us have known that communities of color in particular have less access to health insurance, have less access to health care, a higher chronic disease burden, and often shorter lives. We've all known that. And the pandemic did shine a bright light on it. And now is really the time for us to start talking about it, but to act upon it. And the challenges are really, I think, vast and deep. The inequities in healthcare didn't develop overnight, and our ability to tackle them will be a journey for all of us. And I think it's everything from, sort of the basic and inherent structures and processes that create access to care, as well as quality education about care. The intentional part, we've all been working on health equity, social determinants over the last several years. But one of the things that we've done at St. Luke's is to take a step back and really look hard at our own data on healthcare delivery. Where are the gaps? How are we collecting that data? Where should we start? Because this is a vast ocean of opportunity for us to begin with. And I think the second thing is really doing an assessment, an internal assessment of our own organization. Are we ready to be able to understand and fully move forward as partners with our patients, with our communities, and with the numbers of organizations that I think we can be a convener with to begin to really make a dent in what we all recognize is a significant problem and is unacceptable.
Yeah, I couldn't agree more. And I think, what I've seen is that the conversation has changed, and we're talking about racism, we're talking about poverty, and looking in the mirror and taking action that is intended to make a difference, a measurable difference. I think, Lisa, I'm going back to sort of how you posed the question initially. One of the areas where I think we have to pay attention is to ensure that as we create innovation around technology, that we don't make those inequities worse, that we think about how do we make sure that we make this new way of caring for people available to all. We had an experience over the last year or so working in some of our more vulnerable communities. And I think initially there was an assumption that perhaps the folks who live there wouldn't adopt some of the technology. But we have successfully launched two sort of virtual practices in community centers. And again, sort of creating those trusted relationships, listening deeply and learning, and demonstrating that, this technology can be accessible and can be impactful, and frankly, is a potential tool in addressing some of the inequities that exist.
So can we unmute Katul? I think he's trying to speak and doesn't have the opportunity. Jody?
At the same time. Oh, Dr. Patel, I think you've muted yourself on your end.
There we go.
There
How's that better? It's just a comment I want to make as well, because I just love the words and the direction that all of you have given. To me, I have just found that, partnerships, particularly at a time like this, are really important. We've really reconnected with many parts of the community that historically, even though we had, I would say, good relationship, they weren't, good in a very directional, focused way. We spent a lot more time with the churches. We spent a lot more time with community partnerships that are already in existence. We've got business leaders that are really actively involved in building relationships to address the issues that we all talked about. And I think that, all of us that sit here as leaders, this is a time for us to be even more prominent in our leadership to address some of the major issues that we've got facing in this country. And you just think about healthcare and how healthcare touches everybody's lives. And it's just an opportunity for us to stand here and say, let's unite together as a large-scale industry, but do it in our communities with partnerships that make a lot of sense, and go, if you will, across industries to others. I mean, we've got partnerships here with Amazon to have large-scale vaccination sites in place. We've committed to a certain percentage of our vaccinations for those in the communities that don't have access to technology, or those that don't have access to care. And I think it's an important part of our journey. And what a better place as we're now hopefully getting back to a different phase of normalcy, if you want to call it that, and to set the standard at a much higher level, as we've been talking about now for many years. I mean, I've done it for my entire career, but I want to use this opportunity that we've seen with the pandemic to unite as an organization and treat people the way we should want them to be treated, right, in many ways.
Absolutely.
Just to build on that, I think that I would say that we probably all agree that this is the time in our careers where barriers across the healthcare industry sort of disappeared, and we found ways to work together. We found ways to roll up our sleeves together. We were far more transparent across within markets, across different segments of the healthcare sector, to figure out how to partner together. I think that the obvious ways are in communities. So as we're trying to address health-related social needs, the ways in which payers, providers, community-based organizations, the places where our patients and our members congregate, have all found ways to roll up our sleeves in really, really constructive ways. But really across the healthcare sector, we're seeing public-private partnerships with state governments, with the federal government, around ways that we can address issues like inequity, disparities in who receives the vaccine, who gets testing. That has been truly breathtaking. I hope that that is a feature of the sort of a feature of the healthcare system that persists, that we can continue to sort of focus on what's best for the populations we serve together, and continue to build on that energy, because there's really I think we've been able to overcome a whole host of barriers to really figure out ways to meet the needs of patients better.
Yeah, and let's talk about that a little bit while we're on it, in terms of what are some of the partnerships that you guys have seen grow through this pandemic and through the changes that have come that you think we can now expand on? Bill, you talked about there are some that you've been seeing. You want to talk a little bit about those specifics? Yeah.
Sure. Well, today, actually, it happens to be that today we've released our Bold Goal report, which is it's an effort that started in 2015, where we've identified initially a small set, now 17 markets, that we've invested deeply in communities and created partnerships with community-based organizations, the places that our members congregate, to address health-related social needs. Over the course of this year, whether it's Meals on Wheels and Feeding America to address food insecurity, Institute on Aging to address social isolation, whether it's a whole host of sort of transportation companies and companies that we've been working with to address housing insecurity. We've been able to really sort of deepen our the way in which we transfer data, the way in which we communicate, the way in which we fund and support this work to really address health-related social needs. I think more broadly, though, we've seen partnerships with payers and providers that were really quite profound. In all of our value-based arrangements, we did in particular when providers. We gave out over $1 billion of advance payments to try to advance the advance payments on the quality bonuses and the expected shared savings in our value-based arrangements. Had deep partnerships with lab companies, with vaccine makers to try to figure, and with manufacturers of the monoclonal antibodies to figure out ways to facilitate care. I think really right across the board, pretty much everybody we contract with, everyone we work with, we have figured out ways to ask each other and be really transparent and vulnerable about the challenges we're facing and how we can work better together.
Absolutely.
Yeah, I think partnerships are a really important way to accelerate our strategic work. And we recently announced a partnership with Highmark Health. Highmark Health is an integrated financial and delivery system, and we are a large community-based academic health system that has embraced innovation and embraced value-based care. And we formed a new joint venture. We discovered during the pandemic that we actually had aligned vision, a shared mission, and a commitment not just to improving the system, but really creating a new system of providing care, a new ecosystem, changing the delivery model in the way that I described earlier, one that's continuous, relationship-centered, data-driven, technology-enabled, and really supports people, patients and their providers, so that those moments of human interaction and empathy are occurring at the right time, right place, and are really deeply meaningful, and at the same time changing how we get paid. And so this partnership really, it's what Bill described. It really is about how do we essentially transform healthcare and shift from sort of fixing problems to creating health. And this is a partnership that we're deeply committed to because we believe it gets us to a very different place, a different delivery model, a different way of getting paid, and ultimately something that creates health so humans can flourish.
Lisa, I think Jess brings up a great point. I will tell you, just in the midst of this pandemic, we've gone through a major merger. CHI Franciscan merged with Virginia Mason, and now we're Virginia Mason Franciscan Health. And I will tell you, historically, before the pandemic, the requests and discussions around partnerships were around, if you will, tertiary lives. There was around making sure that we're building an acute care enterprise in a different scale. And this has focused us to address partnerships in a different way. Business partnerships, as I think all of us have said, we've had even unique partnerships with payers, and historically, there was a lot more negotiations and partnerships around that. And I think that, again, I want to point to the fact that coming out of the pandemic, hopefully it gives us all a platform to look at things in a very unique way and say, we're really here, even though we've said it before, we're here to focus on the health of the community and find ways to get care to the community in historical ways that we've not been able to do. So I just love Janice's comments. I think that they're right on, and it's an opportunity for all of us as leaders to, again, as I mentioned earlier, to unite as a group to say, let's focus on the real needs. We've all done community benefit analyses. We've all done, we're rich in data, if you will, in terms of what our needs are. But now we've got to do something about it. And I think that, as you can hear from, some great leaders that I'm on this panel with, I think we're all in agreement that that's an opportunity for us right now.
Thank you.
I might just add something that was alluded to and frame as essential, the comment of federal and state governments and the advocacy that needs to happen, because obviously these are partnerships can be creative. We're shifting from healthcare to health, and really our advocacy agenda and our partners nationally as well in our various states can go a long way to helping helping us with that. Some of it is as simple as keeping some of the waivers and things in place that happened because of the pandemic that really did enable us to think creatively, to work across state lines, to work at top of license, do some things that facilitated these partnerships and facilitated our ability to talk and partner and think with different constituents that we previously, prior to the pandemic, may not have been as willing to do so.
Yeah, absolutely. Great comments. Thank you. I want to open it up now to questions that we're receiving from our audience and make sure that we address some of the things that they're most interested in hearing in. The first question is, I'd appreciate hearing your thoughts about how ensuring staff members, patients, and their families obtain the behavioral health services they need now and in the future. And I think it almost goes to, I think we all know our staff and physicians and teams are feeling a little PTSD after what's gone on in the last year. So how are we focusing on that? Melinda, you want to start us?
Sure, I'd be happy to. You know, I think it's, as the question says, it's no secret that 2020 was an especially traumatic year for our clinicians. And if we look pre-COVID, about 22% of healthcare providers were already saying that they were experiencing burnout. And now, you know, it's well over 60%. And I think, you know, there was an interesting study that was done at the University of Rochester Medical Center that really showed significant and direct connections between provider and employee burnout and employee medical insurance claims, medical malpractice claims, patient satisfaction. So it's not just the clinician's mental and emotional health, it's our ability to take better care of patients. So I think, you know, we have been at this, again, toe in the water some, but I think we need to be introspective and see where we stand on this issue. How's the team doing right now? Creating a supportive environment that encourages transparency, honesty, compassion, kindness, a willingness to talk about issues, and again, a willingness to listen, to understand and not respond, and really keep creating tools that help foster resilience. New equipment, helpful supplies. We had some spaces on all of our units that were quiet. If someone just needed some time to be by themselves, and they looked in very different ways depending upon the type of unit. So a whole host of opportunity, but I agree with you. I think this will be with us not just for the foreseeable future, but forever. I think the impact of this pandemic is going to have long tentacles.
Lisa, just if I could, one of the things that we had learned, that it wasn't just what was causing some of the stress outside of seeing the patients and having to deal with the pandemic was, you know, everything that was going on at home, everything that was going on and taking care of your daily lives outside of work. And, you know, we've actually invested a little bit more in our staff than historically we did. We created a Care at Work benefit fund, if you will, that we invested, allowing folks to use those dollars for supporting childcare and pet care as an example. We're very blessed in the Pacific Northwest to have a legacy be part of our Sisters, and we actually created a Sisters of St. Francis fund that was focused on helping our employees really deal with rent and deal with groceries and issues like that was causing many of our staff members to have even more stress in their lives outside of the day-to-day work that they were seeing around the pandemic at the hospitals or our acute care sites or even our ambulatory sites. And so we looked for areas that would make our team and our staff's lives easier outside of work as well, much like what Wendy had done and commented on. We've also addressed things outside of work.
One of the investments we had made prior to the pandemic was to establish our Center for Work-Life Wellbeing, addressing the issues that Mindy talked about, you know, well-known issue of burnout. And it really shaped our response to the pandemic in those early weeks and months. And I think, you know, Katal, same thing, you know, how do we support our caregivers outside of work when they were so worried about childcare and isolation? So we paid for childcare, we paid for hotels. But I think, you know, what has been so important about the work that the team, and it's a fairly large and multidisciplinary team, is that they were out and about every day connecting with caregivers and connecting them to each other. We have peer counselors, connecting them to mental health service if that was called for. What I have learned from the team there is this concept of collective trauma. And I think we keep looking for it. It's better now. We have fewer patients. That things are settling down. But that experience that all of us have had over the course of the year, in many ways, is starting to manifest. And we've actually seen over the last few months an increased need to support caregivers, which is something I'm not sure I would have really sort of anticipated. And again, I think, lessons learned. How do we take, everything that we have experienced this year and ensure that we are creating that system to support our people in a way that is sustainable? I think workforce, ask any CEO, workforce is a top of mind issue. And it's not just the capacity, will we have enough, but how can we all do a better job of caring for our people?
Yeah, and Janice, one of our next question was, beyond telehealth, and what other areas has technology adoption been accelerated in healthcare as a result of the pandemic? And what you just said, I think, is one of the things that we're seeing pretty broadly, and I'd like you guys to comment on, in terms of we're seeing more adoption of AI and RPA because we are seeing people actually leave the healthcare industry because of the stress. And we had a resource constraint before. Do you see technology helping to resolve some of those issues? And what other forms of technology are you using?
I would say absolutely. I think that, we have focused more on sort of the use of technology to provide clinical care, but there's an enormous opportunity in healthcare to apply technology to eliminate some of the waste, particularly around the administrative functions that are expensive and frankly don't add a lot of value. And so, our mantra here has been everything that can be digital will be, and everything that can be done in the home will be. And we're now thinking about, it's not just clinical, but, how do we work from home so that we could be more efficient? And then how do we employ technology around those administrative tasks to again, create value and support people? We'll always need people. We need to be able to deploy technology so people can connect to whatever it is that brought them into healthcare.
And in the spirit of what Janice is saying, I agree completely. But as we're figuring out how to deliver care better digitally, care in the we need to understand the underlying risk or the accelerating risk of the patients we care for. And that requires us, that demands a better use of our data, about more liquidity of our data, more interoperability of our data, to be able to really understand the needs of our members, and to be able to predict events before they happen and try to intervene. So I think that's a really key one. Similarly, the ability to collect more information from our members when they're at home. So whether it's through other kinds of remote monitoring or whether it's just the way we communicate with them, so we're collecting more of their self-reported information. Those sources of data increasingly are going to support the way in which we can be more of a proactive partner with our patients to care for them.
Absolutely. So one of the things that I love best about this discussion that we're having is when we took on this topic, I thought, leading through a crisis, still talking about the pandemic, we were going to be talking about some pretty negative things. But you guys have really focused on what are the positive things that we got out of this. And I think that's really important for the future of healthcare. Can you each maybe talk for just a minute around what do you think is the best thing that came out of this pandemic that we're going to be able to take full advantage of? We've talked about a bunch of them, but what do you think is the most important? Mindy, you want to start?
Sure. Well, for me, I think to paraphrase Winston Churchill, the pandemic was our finest hour. If you look back in the January, February timeframe on the West Coast, when we first began to see COVID, we didn't know what it was. We were unsure what was going to happen. None of us would have imagined that we'd be still talking about this today. But we did what we do in healthcare, put our patients first and say, we know how to take care of sick patients. We know how to take care of infectious patients, and we will do what we need to do. And our frontline caregivers and all of the people who support them stepped up, did what was asked, did more than what was asked, and continue to do that every day. And so I think the positive there is it was our finest hour, and we cannot thank our frontline folks enough, and we also cannot underestimate just the ability of the healthcare field to adapt and to focus on our patients and on our communities.
Thank you. Janice, you want to go next?
Sure. I have tried to not talk about the silver lining in COVID. Again, there's so many people who suffered in so many ways. I think we honor them by making sure that we create a health system going forward that is steeped in value, is deeply personalized, addresses the inequities that we have learned so much about in the last year, and creates a way of delivering and paying for care so that it's affordable. It's affordable for the federal government, for state government, for the patient, and for families. And I think Mindy is absolutely correct that our finest hour to date has been how we've responded to COVID. There isn't a single hospital in the States that said, what should we do? We just rolled up our sleeves and we started doing. I think we can ensure that we have a finest hour yet to come by taking everything that we've learned and really creating that health system that we know can meet people's needs in fundamentally different ways that create health.
Thank you. Katul?
Thank you. I think all of us are likely going to be aligned around the answer that is about our staff and what they've been able to accomplish and how wonderful it is. I'll add one other thing. For us, we had just become Common Spirit Health about a year and a half before the pandemic hit us. We're a new organization. You think about it, Common Spirit as a national system is attached to every time zone in this country, and we're in many different states with many different governors. It actually forced us, if you will, to bond in a much more aggressive way. And as an example, we have stories of when the surge happened in Texas or the surge happened in LA. There were supplies that were being sent from Nebraska to different parts of our Common Spirit organization. And to me, that's one of the finest hours for our organization. We all came together, we all aligned together. The other part of this is even locally, I got to know many of our leaders, CEO leaders around the state. We were having Sunday and Saturday calls with each other. We had one with several of them with the governor of Washington on Sundays. I mean, we were doing everything we could to make sure that we were partnering together. So when folks that didn't have that kind of collaboration before needed help and support, we all jumped in together as a group. And to me, I think that's what's going to come out of here, with this pandemic that I'm just in absolute awe of. Exactly. But I just love the comments that both Mindy and Janice said as well.
Thank you. And Bill?
Sure. Let me pile
You get to wrap us up. You get to wrap us up.
Perfect.
Anything else you'd like to add before I close the comments?
Yeah, I'll just add that first that, you are hearing enthusiasm from us about the fact that we think that, the healthcare system stepped up in a lot of really important ways and it has rapidly evolved. But you're hearing sort of a humble enthusiasm, I believe, because we all are grateful that we were in a position to help so many that were struggling. I'd say the one word or the one theme that I hope to see continue is really trust. I think over the course of this last year, we've seen such a deeper trust of each other, of our patients, I believe, deeply, deeply trust that we're doing whatever we can, oftentimes at great risk to ourselves, to try to meet their needs. And I hope that this recognition and this sort of deep trust between providers and patients in the health system is one that it just really persists.
Okay. I just want to take a moment to thank our panelists. We really appreciate everything that you've shared today, and thank our participants. And we certainly appreciate your time and hope that you enjoyed the conversation. Jody, would you like to say any final words?
We appreciate you, Lisa, and the support from EY. So thank you for moderating this panel, and panelists, thank you so much for being here.